Hello everyone. Welcome back to my channel. Ginger is an ancient spice and herbal remedy that originated in Asia and has been used in traditional medicine for thousands of years. The root, or rhizome, is primarily utilized for both medicinal and culinary purposes. Modern research has validated many of ginger's traditional uses, showing it can help reduce nausea, relieve pain, lower blood sugar and cholesterol levels, and decrease inflammation. Compounds such as gingerol, shogaols, and zingerone give ginger its potent effects. Proven benefits include alleviating nausea from motion sickness, pregnancy, or chemotherapy, and improving symptoms of osteoarthritis, menstrual cramps, and post-exercise muscle pain when taken regularly. Ginger also adds flavor and zing to dishes as a culinary ingredient. However, while ginger is generally recognized as safe, certain populations may experience adverse effects or interactions. In today's video, we will review specific health conditions where medical experts recommend avoiding ginger or using it cautiously. I'll provide an overview of the concerns and offer tips for safer ginger consumption. As with any supplement, it's wise to discuss ginger with your doctor to determine if it is appropriate for your health history and any medications you may be taking. Ginger can be a beneficial herbal remedy when used responsibly and under medical guidance. Now, let's take an evidence-based look at who should limit or avoid supplemental ginger intake. 1. Bleeding disorders. Ginger contains compounds that can thin the blood and inhibit clotting. For individuals with bleeding disorders such as hemophilia or von Willebrand disease, VWD, ginger supplements are not recommended. VWD is an inherited condition that causes prolonged bleeding after injuries or medical procedures. The anti-clotting properties of ginger could exacerbate bleeding and bruising in those who are already susceptible to these issues. Even culinary amounts of ginger may extend bleeding time in these populations. This effect is particularly concerning during an acute bleeding episode, as ginger may inhibit the body's natural clotting process. Those on blood-thinning medications like warfarin should consult their physician before taking supplemental ginger, as the combined effects could increase the risk of uncontrolled bleeding. Therefore, individuals with known clotting disorders or those taking blood thinners should avoid concentrated ginger supplements and limit their intake of culinary ginger. 2. Diabetes. Ginger has been shown to lower blood sugar levels, which can be beneficial for diabetes management. However, this effect also requires caution. Consuming ginger alongside anti-diabetic medications could lead to additive effects, increasing the risk of hypoglycemia, low blood sugar. Symptoms of hypoglycemia include shakiness, sweating, rapid heartbeat, confusion, and seizures. Individuals with diabetes should closely monitor their blood glucose levels when taking ginger. Medication adjustments may be necessary under the guidance of a physician to account for ginger's glucose-lowering effects. Ginger capsules have a more significant impact on blood sugar compared to powdered ginger. Therefore, it's advisable to consult with an endocrinologist or diabetes educator before regularly using ginger supplements. 3. Heart conditions. Due to its effects on blood pressure, cholesterol, and blood thinning, ginger may interfere with certain heart disease medications. Individuals taking nitrates, calcium channel blockers, beta blockers, and statins should exercise caution with ginger. Its blood pressure lowering properties can cause hypotension when combined with these medications. Those with existing hypotension should also be aware of potential ginger interactions. Additionally, people with cardiac arrhythmias may be sensitive to ginger's stimulatory effects on heart rate. It's important to have an open discussion with your cardiologist about the safety of ginger in relation to your specific cardiac medications and overall heart health. While therapeutic doses of ginger may be acceptable under medical guidance, excessive consumption should be avoided. 4. Acid reflux. For individuals with gastroesophageal reflux disease, GERD, and chronic heartburn, ginger may exacerbate symptoms. Ginger contains compounds that can relax the lower esophageal sphincter, allowing acidic stomach contents to flow back into the esophagus, causing damage and irritation. While occasional use of culinary ginger might not be problematic for those with mild reflux, concentrated supplements could provoke symptoms like burning chest pain and regurgitation. Those with reflux should limit their ginger intake and discontinue use if symptoms worsen. Consider switching to other herbal teas and spices that are gentler on the gastrointestinal tract. 5. Gallstones. Ginger has been scientifically proven to enhance bile production, aiding in the digestion of dietary fats. However, this effect can be problematic for people prone to gallstones. Excess bile can concentrate in the gallbladder and contribute to stone formation. For those who already have gallstones, ginger's stimulation of bile flow could trigger colicky pain and gallbladder attacks. If you have a history of gallstones, it's advisable to avoid large or concentrated doses of ginger. Mild use through tea or cooking is less likely to cause issues, but pay attention to your body's response and discontinue use if any gallbladder-type pain arises. 6. Kidney disease. Due to its diuretic properties, ginger may affect kidney function, particularly in individuals with compromised kidney health. Ginger can increase urine output, potentially leading to changes in electrolyte levels and worsening dehydration. If you have impaired kidney function, exercise caution when consuming therapeutic doses of ginger. Ensure you stay well hydrated to avoid complications. Start conservatively with low amounts of ginger and monitor your body's response. If you are on diuretic medications, discuss ginger use with your nephrologist, as a combined diuretic effect may develop. Culinary use of ginger should not pose any issues for most people with healthy kidneys. 7. Surgery. Ginger's antiplatelet properties are particularly relevant for individuals undergoing surgery. Ginger can inhibit normal blood clotting, increasing the risk of bleeding and bruising during surgical procedures. If you have an upcoming surgery, it is advisable to discontinue ginger capsules or tablets at least 1 to 2 weeks before the operation. This allows time for ginger's anticoagulant effects to diminish, reducing the risk of surgical complications. You can resume ginger supplements after your post-op recovery under your physician's guidance. Always disclose any herbal supplement use to your surgical team. 8. Pregnancy. Concerns exist about the safety of consuming high doses of ginger during pregnancy. Ginger might increase the risk of miscarriage by stimulating uterine contractions and menses. While some studies have found ginger helpful for nausea in pregnancy, experts encourage conservative dosing. Pregnant women should minimize intake of ginger supplements and concentrated forms like extracts. Include ginger only occasionally as a spice in food instead. Discuss ginger use with your OB/GYN to determine what is suitable given your pregnancy factors. They can monitor you for any red flags if you decide to use ginger. 9. Ulcers. People with ulcers in the stomach, duodenum, or intestines should avoid therapeutic doses of ginger, as it can irritate the GI lining. Ginger's spicy and energetic properties can particularly aggravate existing ulcers, with concentrated supplements potentially causing a burning sensation and worsening ulcer pain. If you choose to use ginger, start with very small amounts to gauge your body's response and discontinue use if any discomfort arises. Limit ginger to minimal culinary usage until your ulcers have fully healed. Afterward, you can discuss reintroducing ginger supplements with your gastroenterologist if desired. 10. Endometriosis. Ginger contains compounds that can stimulate menstrual flow, which is important for women with endometriosis to consider before using ginger. This stimulation may worsen cramping and pelvic pain associated with the condition. Additionally, ginger's effects on estrogen levels might exacerbate symptoms. Those with endometriosis should consult their gynecologist before taking ginger supplements or ingesting large doses. You may be advised to limit ginger consumption during your periods when symptoms are more active. As with any supplement, start with a conservative dose and discontinue use if discomfort increases. In summary, ginger is a powerful spice with therapeutic benefits, but it also has potential side effects and interactions to be mindful of. Discuss with your healthcare provider to determine if ginger supplementation is appropriate for your health status. For most people without underlying conditions, enjoying ginger in culinary dishes or tea should not be an issue, just don't overdo it. I hope you found this information helpful. If you enjoyed watching this video, don't forget to like, subscribe and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.